In the last video, we made a debate on the anatomy and the physiology, which is good for the physiotherapy. We conclude that which is good, bit like from a particular comedy. We said that which has the power. You have to beat this. You have to beat this. Not like that. We are going to see that case based on these two studies, like an anatomy and the physiology. Both are how the it combined in a patient's life and in a patient's treatment and his assessment. Uh, I have posted with a 65 years OA knee patient. Like she is having grade 4 OA, but she has suggested that from a doctor, from orthopedician, well-versed orthopedician, she has to go for a TKR, like a total knee replacement. You have heard it of. In this total knee replacement, the bone part which is eroded, which is weird and teared, is going to cut off, and we have going to place a cap-like structure from a femur and also in the tibia. This is called as total knee replacement. Because she's also an old patient and she's also having a joint swelling with the both two legs, bilateral ONE. Then she came to our clinic, to my clinic. She then, for her I suggested that we have going for a rehab. Like it will take 2 to 3 months. In 1 or 2 days, it won't recover. Like if you are going to a gym, we work out for 1 or 2 years, then only we can get the results. Not in the 1 or 2 days. First, we started with the pain management, because the pain management is the first thing we have to do. If the patient is having a pain, we can't able to make the patient to do the rehabilitation exercises. First we went for an pain reduction protocol. Like we did which muscles are getting affected, we assessed which muscles are getting flaccid, we assessed, and we then started the releases for the spastic muscles and the tightened muscles. Then the progression is going on. Then we started in 1 or 2 weeks, we started a mild stretching exercises and then for the strengthening exercises. And also with these anatomical part, we have included the physiological part from diet management. And also we have checked the HbA1c levels regularly, BPs. Then on we can include the diet managements like nutritional benefits, which is lagging. In the pain, we have if the sodium and potassium levels are getting lower, we are not able to manage the pain, and we have to concentrate on the collagens of the muscles that should be built up, so only the pain of these patients will get down. So we have to concentrate on the physiological part like ESR, then nutritional deficiencies like sodium, potassium, calcium, because she is an 65-year-old woman having these issues. Usually we have issues with postmenopausal women, like with these calcium deficiencies, sodium, potassium pump deficiencies, and also this wear and tear also get joined in there. In this case, we have concluded that we have to do the anatomical part assessment, and we have to get the diet management and also the supplements with through the food. Then she got recovered for around 3 to 4 months. She got recovered. She don't need a surgery. She then sits in the ground and got up from the ground. For a 65-year-old woman, it's impossible to do this. Then she got very happy. While going out from my clinic, she got very happy and she referred more and more a number of patients to the clinic. So what it denotes, we have to concentrate both on anatomy and on the physiology for a case improvement, not only for these pain cases and also for the rehab cases like our stroke patients and all the other cases you are going to see in your near future, in your internships and your own practice. You have to concentrate on the both. If you are having any issues with those, you can refer the patient to a general medicine, or you can itself write and give for a diagnostic test. You are having any calcium deficiencies, or if you want any anatomical structures like wear and tear of the joint, then you can ask the patient to go directly to the diagnostic centers and you can write it by yourself. Since we are the authorized persons. Okay, we are going to end this session, and hope you got knowledge about the anatomy and physiology part, both how it goes on with the patient's wellness. Thank you.